Sophia, we gotta meet outside of webinars, Sophia.
I know. How are you?
No webinars. Good. Are you in California or are you back? Oh my God, let me take away my horrible student apartment background. I'm
Oh
sorry.
my God, you're fine. I'm in
There.
Saipan. I'm at the council. Hi, Maria. I don't think we've met, right? Nice to meet you virtually.
Hello, hello.
Let me change my name.
For some background too, Sophia, Maria, and I were in Youth Congress at the same time.
Oh, very
In
cool.
high school. So
That's
I guess
awesome.
we're still friends.
Where are you, Maria?
I'm here in Saipan actually.
Oh, okay.
Got here like 2 weeks ago from Oregon.
Oh, cool. Welcome home. Let me just make sure. Are you going to be sharing your screen? Who's going to be sharing their screen?
I guess I can.
Okay, so I'm going to make you the co-host. Okay, so you can share your screen. And let's see.
We're just gonna make sure nothing bad pops up.
Always important. And our attendees are going to start coming in. Oh, there you go. That's nice.
Let me just refresh. And then Maria, if I get your slides wrong, just direct me. How have you been, Sophia?
Oh, we're busy right now.
Yeah.
But good busy, you know. We're just starting to plan or get just iron out some of the Pride activities in June, which is going to be super fun. It's like a stacked calendar.
Yeah, let me know if you want. I know last time it didn't work out, but I'd love to help out with any Pride stuff. If you have
sure. I'll make a note.
Have any need for me?
You
I
know,
mean, I'm gay and I'm here, so.
Actually, we were planning on posting, or not posting, but publishing the winners of the Pride Talks writing contest from a couple years ago, which includes you.
Oh, from last year, yeah.
Yeah, having them published in the paper. So you signed a release, right, for your work? You're comfortable with us doing that?
Yes, I signed my life away, yes.
Okay, good.
Yeah.
Yeah, so you will be making an appearance in that regard. And then I can connect you with anyone that you might be interested in talking to, with the organizing. Unfortunately, one of the organizing meetings is happening at the same time as this webinar, but they tend to be around now every Wednesday for Pride Marianas Youth.
Oh, okay, so it's still Dr.
Maritita.
Maritita, yeah, right.
And then there's Pride Marianas as well, and they're making moves to incorporate, they're definitely expanding.
Nice.
Anyway, I might just mute for now unless I can help you with anything, and we'll wait for our attendees to come in.
And there's no need to admit them or anything, right? It's all
no, they just pop in.
Okay. And it's not recording yet, right? You're gonna record at noon?
It's recording.
Oh, okay. You'll cut this out, right?
Of course, yeah. Don't worry.
I just said I'm gay in here, so.
That's why I haven't been saying anything. I'm cognizant of that record.
Oh, I just trusted it. Okay,
it's okay. When we post it, we cut the beginning, so you're all right.
I'm a God-fearing child.
Okay, I'm gonna mute. Okay, just let me know if you need anything.
Maria, weren't you just at a christening or something? I just saw your Instagram.
Oh no, I went to this local cake place and just had some cake and then rushed over and got ready for this.
Oh, nice.
Yeah.
And you're still there for another 2 months, right?
Yeah. My partner is like in the background. He's like, "Can I make noise?" No, you can't.
Oh, we didn't discuss Maria, but did you want to frame the issue, or is that because you're leading right with public health for the first one?
Did you literally want me to say like verbatim that part, framing the issue?
I don't know. It could just be like whatever you want, and then just jump right into your. I
Sure.
just figured we didn't discuss who was gonna go first. Yeah.
Okay, yeah.
Okay, everyone, it is 5 p.m. here on the beautiful island of Saipan. And if you're all ready, we'll maybe get started with the webinar. First things first, my name is Sophia Perez. I'm the Program Officer for the Northern Marianas Humanities Council. This webinar is titled Public Health and the Media Amid a Pandemic, and it examines the general response to COVID-19 and how the local and national media play a role in communicating public health guidelines and preventing misinformation. Today's presenters will examine recent events that involve vaccination hesitancy, media portrayals, and public discourse on overall health. So today with us, we have Ms. Maria Dizon. She's a Master of Public Health student at Oregon Health and Science University and a National Institutes of Health Build Exito Research Scholar and McNair Research Scholar. She's an alumnus of Northern Marianas College and has 7 years of health research experience with focuses on alternative medicine, animal venom, Pacific health disparities, child anthropometrics, functional brain imaging, and pediatric clinical trials. She currently works as an epidemiology researcher at Multnomah County Health Department in Portland, Oregon. Ms. Maria, thank you so much for being here today. And we also have Mr. Thomas Manglonia II, a graduate student in journalism at Stanford University. He received his BA in Media Studies from the University of California at Berkeley and is an active member of the Asian American Journalists Association and co-founder of the Pacific Islander Journalism Task Force. So, Mr. Tomas, thank you so much for being here as well. A little bit of just like a formatting thing. We have the presentation, and then afterwards there's going to be a question and answer. You're welcome to post your questions in the chat, or at the end, you can just message them to me and I'll read them out loud. But for the time being, let's just go ahead and start the presentation. Thanks so much for being here, and whenever you're ready.
So first off, hi folks, this is Maria, and starting with labeling the problem. Overall, our talk is going to be about the interplay between public health and the media, and I'll be going into one of the issues that is very relevant to our time today on the next slide. So on the public health end, we ask, how does COVID-19 disproportionately impact communities of color? So first off, let's look at the scope and why might it be different for communities of color. Often, even in my experience, we live in multi-generational households, meaning our grandmas and our aunties are all in the same, as opposed to Western families or families in the United States who are more nuclear, just have mom, dad, and other immediate family members. So that's one thing to take note of, needing to social distance and be apart from one another. Being in that multi-generational household may make it difficult for some families. Also, living spaces are very different for communities of color. Some of them are often low income, so you might be in a smaller living space or a crowded living space. And lastly, there is a higher frequency of working in a public facing job, meaning you have a higher chance of contracting COVID because you're working as a cashier, as a frontliner, etc. And we go into the conditions that shape why communities of color are more highly affected. Well, there are social conditions that we know of, or at least in my experience in public health, is that communities of color are already underserved in the healthcare system and the health system beyond. So we already experience these significant disparities that make it difficult for us to live full, happy, and healthy lives. So what this pandemic did, and you'll hear that over and over again, especially in these health circles, is that COVID-19 magnified the gaps that were already there. So it didn't mean that COVID-19 uncovered something that we never knew before. In public health, we already know that significantly communities of color keep getting left behind continuously. And what this pandemic did was only amplify that. And that's a huge, huge call to action, but also extremely saddening because it had to get this way because of all the underserving so far. But now on the public health end, we have to realize that everything is compounded by layers and layers and years of being underserved. Things like having less access to care. There are language barriers that make it difficult for people. There's mistrust and everything else that we entered into the pandemic already, that we were at a significant disadvantage overall.
Thanks, Maria. Hi, everyone. It's Tomas here. And in talking with this about Maria, with Maria, we were wondering why does the way the media cover the pandemic matter in a public health response? And I think to further frame the issue today, we can see that both public health and journalism as a news practice are both public institutions. And so when we talk about media today, it's defined as private and independent news outlets with professional journalists whose job it is to report the news, hold institutions accountable, and raise new questions that help us better understand our circumstances. So separate from entertainment or regular social media. And so why does this ultimately matter? And so we know that during any crisis, the way the media portrays events at any scale can either serve to either prepare the audience, prepare the community in an effort for the worst. The media's response and the way and the tone in which they report can also provide the community with neutral reportage, simply regurgitating the information. What is the facts? What do we know now? And the media can also sensationalize the events and stir a panic because of maybe not as extensive reporting. Or also lean on experts and leading voices to calm the community. And so when we talk about news, we talk also about news judgment, the decisions made by editors and their trained reporters, which is very vital for a healthy media ecosystem that needs to also be prepared to act quickly to inform, but is also very cautious before sounding any alarms in the community. And so how might this impact you, me as a consumer, as a member of the community in the Marianas? The media you share and the outlets you reach for largely responding to the audience's behaviors and needs. So when we demand better, fairer, more in-depth coverage, that becomes more possible. We've also, we all know WhatsApp and Facebook are not media outlets, but how we use them contributes to the disinformation. And so as a part of that, we wanted to provide some real examples of what that looks like before going into localizing the issues. So I just wanted to jump ahead here and show how the Asian American Journalists Association called on news organizations to exercise care and coverage of the coronavirus outbreak. And here, this is commenting on national coverage. Kind of the three umbrellas that they suggested was that the use of images of people wearing face masks without providing the proper context. And so here, we're kind of the the media advocacy organizations are urging that who we show when we talk about the virus really matters, because that can attach a certain stigma to them. Also, use of generic images in our reporting when we talk about issues, when we talk about problems. Are we using intentional visual images, intentional words to describe this so that we don't attach it to any one particular community? That also leads into the third kind of guidance that they offer, which is, use of the terms like the Wuhan virus or the China virus or the Chinese virus or any other term that uses geographic locations or refers to a population to describe the virus. And so we see here that the way that the media describes even the science, which might seem, factual, kind of not debatable, is also up for debate in that sphere of the media as well. And so we wanted to kind of combine the two institutions here and talk about what impact, again, does language have on a public health crisis, continuing on that conversation.
Yeah, thanks, Tomas. On my end, for public health, media can actually spur a lot of action, call to action and concern. For example, instead of just saying, a possible issue for COVID-19, for a place to be an issue for COVID-19, we can use the terms hotbed for COVID-19, just to relay the gravity of the situation and say, oh, this can be very serious if we don't choose to vaccinate or protect ourselves or wear masks. Or we can frame the vaccine, instead of a painful shot, we could say, oh, it's protection against the virus. So are you protected yet? Things like that, also being intentional with the wording. As we know, language does affect the way that people respond and comply with COVID-19 guidelines. We see it in public health currently with how people comply with lockdown, with changing directives, changing mandates. They can be not as favorable when we're saying the words lockdown, directives, and mandates. They kind of seem like you're taking someone's autonomy away and being like big government or somebody else telling you what to do. You can use different words such as stay-at-home order or protective measures to kind of frame it in a more positive light in that way. So language does make a big effect in the public health crisis, especially when we're using a lot of public health terminology. And I would say, in my opinion, that we have not done a good job of defining this in the most digestible way for communities to understand what's really going on. We use a lot of public healthy words, jargon that I call it, between like clusters and doses and antibodies, which is okay. But what is the application to your daily life as a consumer and as a person in the community? Again, as Thomas alluded to earlier, messengers matter as well, not only with the pictures that you use and the wording and the framing. Where are we accessing a lot of the needed timely and relevant and factual information? Because we can have all of that on CDC and all these websites on this end, but who is relaying that information, and do we trust them as part of the community? And overall, are they the right people to be relaying all of this?
And to continue on that point with regards to language and the jargon that Maria definitely, talks about, is also what's important is to point out that trust in government is separate from trust in the media. However, they can feed each other, which is, kind of the reason why Maria and I thought we, should combine and be in conversation with each other with the two different institutions. And so in this case, I think this is one of those rare occasions where media may work with public health as an institution for local campaigns in terms of informing where vaccination sites are, talking about what really is the recovery time for someone who might be recovering from COVID-19, scheduling interviews with experts who, use the jargon, but can also explain it in a way that is really understandable and accessible to the community. I think also speaking about platforms, really important that public health, government hold press briefings on a regular basis, and also just utilize the range of tools that are available that we that allow us to communicate the science in a non-sensational way, especially when there may be no reason to really cause a panic. And that leads us to kind of the second umbrella point that we have today about localizing the issues.
So a very common issue right now in public health is vaccine hesitancy, and understandably so. I mean, medical mistrust and mistrust in general in our health system and healthcare is very understandable from my point of view because of a lot of mistreatment and systemic racism, and in general, just not doing what we should do in service to people, especially communities of color. There's an example called the Tuskegee study, where there's the unethical treatment of Black men with syphilis, but they were lied to and told that they were being treated for bad blood, when in actuality, there was no treatment at all. And even then, when penicillin was discovered to be safe, most of these Black men did not receive the medicine that they needed. So that is a very stark example in public health and health in general about how researchers and health systems, are identified to do good things and for discovery and for the goodness of health for everyone. But in reality, this is what has happened. And understandably so, communities of color specifically have this trust towards us. And we have to understand that, especially anything about our health for anyone, decision making is extremely personal, and it is shaped by a lot of internal and external factors. There's things called the white coat syndrome, where your blood pressure rises when you're in the hospital room and you just feel nervous. I feel that interacting with my doctor, even if I am a public health person. People may have different experiences in the healthcare system. People have different levels of privilege, whether that is with the access to information, to having a good provider, whatever that may be to them, and the access to resources. So those are some of the things that shape that ultimate decision whether to vaccinate or not. And also, one thing to take note of is we live in such a information packed age. Like, the internet is at our fingertips. I'm talking to you online via Zoom. Like, we can connect through this space, but at the same time, it can be very interesting, to say the least. We can engage with people, but we can also find that not all of the facts that are stated are factual, that lead people to really question what are they consuming. And I hope they do, for the sake of media literacy. But it can be extremely overwhelming because we have all these websites. Public health is rampantly trying to meet the gap of how we've been underserving people, even on the information lens. We're not working alongside media professionals and experts to get the word out in a good way. So overall, it can be very, very overwhelming. And public health has this tall order of, okay, how do we address vaccine hesitancy?
And I wanted to talk for a bit about the platforms, which I discussed briefly. I mentioned press conferences, and I think having them regularly is a unique opportunity, not only for reporters to ask questions, but to solicit them from the communities that we report on, right? Or report with or live with. And so soliciting those audience questions, whether they be through private message or comments, is really important, especially if you're in the media, to be sure that you're in touch with the communities that you cover and aren't only interested in the stories that you might be pursuing of the day. Um, Again, bringing in those experts and access to information in an accessible way. But I also wanted to just also create innovative ways to communicate the message. There are several examples across the globe that look at how communities, for example, in Detroit, utilize text messaging as a platform for official messages, not from government or from public health, but from news agencies. Graphics that are meant that can really help communicate how the virus spreads or what it looks like when you have a mask on and what that prevents from happening. Also having interactive media. The New York Times recently came out with a virtual reality, augmented reality experience where you can see kind of the virus in the air and what air circulation in a particular room or environment can look like and what that means for your health. And so there's definitely a role here that media can play. And we also wanted to provide some local examples. And I wanted to offer up this report from a colleague of mine while I worked at KUAM, which many of you know, Adriana Cotero, and an issue that is, is on everyone's mind and has been since the news broke of CNMI firefighters that were terminated for refusing to take the vaccine per a mandate.
On February 18th, the Commonwealth of the Northern Mariana Islands Governor Ralph Torres sent out a directive mandating all executive branch employees and activity heads to get vaccinated. This includes frontline agency employees at the Department of Fire and Emergency Medical Services and Department of Public Safety. As a result, the DFEM's Commissioner Dennis Mingiola sent out termination notices on March 19th to 9 firefighters who refused the COVID-19 vaccine, including the agency's now former Public Information Officer, Derek Gersandi. The notice for proposed adverse action served as a 30-day advance written notice on the employee's termination. Former DFEMS employee Adam Safer shared his notice with KUAM, which states, quote, "This requirement to be vaccinated was the first step in ensuring that you, your coworkers, and the community you serve are protected against the deadly virus. Your failure to adhere to this directive is considered insubordination to issued government department policy." Both Gersandi, Safer, and other fired personnel respectfully declined an interview as they plan to take legal actions against the local government.
And so I just wanted to play a clip of that for those who might not be aware, but I'm sure the conversation is very much on people's minds and recollection. I mentioned this because I think when this story first broke and as we started learning more and the situation evolved and more people said things in public, whether through written statements or in person, I as a reporter, my first inclination was to provide all the context that Maria just said, right, about vaccine hesitancy. My inclination as a reporter is to also, how do we humanize these voices? I think one of the major problems that journalism as an industry has is the idea of both sidisms, right? That we tend to provide equivalences. We see this often in climate change coverage, where 99% of scientists say climate change exists and is a problem that needs to be addressed. And 1%, 0.1%, whatever it may be, says that climate change is fake. But yet in mainstream media narrative, traditionally, those two voices are held to the same stature, to the same equivalence. And so when I look at stories about this vaccine hesitancy, I really am aching for kind of a humanization of the voices in the story, not telling the story in a binary way, us versus them. There are multiple angles to every issue, not just vaccine hesitancy. And I guess the question that we all have now is, how do we communicate the depth and breadth of the issues that we face on the ground and in a community-oriented way? Some people call that solutions journalism. That could just be journalism, and that is deeply reported. And also not relying solely on press releases and government-produced information is really important. I think looking at different platforms, we've also seen the Saipan Tribune and other newspapers across the United States take this approach of having at a glance or a daily bulletin of sorts. We've seen some news outlets in the United States also stop doing this because of kind of the effect that they've seen reporting every single case as a breaking news story, and what that might and kind of the atmosphere and tone that might make. That's an editorial judgment. I'm not making a personal one myself, but it is something that newsrooms are debating whether or not to continue this type of reportage, and what it means that every time there's a case, if we were to treat it sensationally, instead of saying that there is a system that is able to handle this well. And again, this is from the perspective, of course, from the media. We also have other headlines here written by other reporters talking about this case, of course, of the fully vaccinated frontliner testing positive for COVID-19. The story goes into, of course, how the vaccine makes the illness less severe if you were to contract it. But we've also seen how headlines of vaccinated people, how headlines can also be more holistic as well. And further down in this particular story, we also see the government here signaling this notion of rumor control, and to stop spreading misinformation regarding businesses or individuals. And I think one thing that is particularly interesting is the note to only share verified official information from the governor's COVID-19 task force and Commonwealth Healthcare Corporation, which the media can rely on as one source, but also as reporters, it's definitely important to check other sources and hear the concerns of the community and fact check those before reporting any of them out, of course. And so we wanted to take a step back and also just look ahead of with everything that we've offered today.
So on the public health end, as we look ahead, is that just want to amplify Tomas's point about how there can be divides amongst people and views. And it's kind of the same thing we've noted in public health research, is that yes, you have people on either end, whether that's the extreme or in the middle, but the more that you count them out and look at them as other, the research has shown that people buckle down, regardless if those opinions are right or wrong or factual or whatever we wish to term it. So one thing that I would leave, even as a general person in the community, a public health practitioner, anyone in the community, is to communicate and don't shame. At the end of the day, as much as we come from a place of, hey, we're trying to protect the community, we have to recognize and also humanize this point of, this person is concerned about their health and the effects and how that would affect their whole family, immediate family. We can talk about how we care and how we want this herd immunity, etc. But people are fearful, understandably so, because of the myriad of information, so many rumors, so much going on, and in general, a very human response to a pandemic. So communicate, don't shame. Those who are, we term it as vaccine hesitant, are not necessarily non-believers of science. These communicating these facts, but also being aware of the delivery, who is delivering it, that real-time information as the pandemic keeps evolving, those risks and benefits in a digestible way for people to understand. We want that to be foundational to them, to making that right decision for themselves. As much as a biased public health person, yes, do this, yes, do that. At the end of the day, we want to empower people by having all the facts and information needed to make a good decision for them. Along with that, as public health practitioners and general community members, especially for my field as a researcher, we do have that burden of proof. And instead of pointing the finger to others and saying, why can't you do this? It's so simple to understand, the science is there. We have the burden of proof. I believe that public health practitioners and scientists, etc., have that burden of proof to meet the community where they are, instead of constantly shaming other people and other points to get where we are, because we haven't personally done a good job of meeting the people where they are. We also have to recognize that a lot of the systems we are a part of perpetuate the same harms that we've done before, whether it is, again, through medical mistrust, how we interact with the healthcare system, some healthcare providers, myself as a public health practitioner, and the general field. We're still part of that. So we have to recognize that despite having good intentions, right, we have to look at that impact. Lastly, leave you with that public health and anybody in this field must not and should not operate in silos. As we see here, working alongside Tomas, we really see that connection of how we could bridge that divide with their expertise about journalism and media and all that amazing stuff. There has to be some kind of wraparound approach, whether that's through the community, through families, providers, media, policymakers, etc. We have to look at things more holistically because that's who we are as humans.
Thanks, Maria. And to wrap up with looking ahead, I think rigorous reporting is always the answer to how to improve media coverage. And I think it's especially important to note that as more people are vaccinated, the media should communicate clearly what the new guidelines are and be able to keep up with an evolving situation. I think reporting early on in the pandemic, the phrase we heard a lot was rapidly evolving situation, because that, cliches are true for a reason. And so I think it's the job of the reporters to definitely keep at that pace, in an effort to have that rigorous reporting at the end of the day. Also, it can't be said enough, the role to question and challenge institutions and the models that they implement. Whether that looking at the intention, from every point of view that is rigorously reported. Is this something truly motivated by public health? Is this something that could be tied to business interests? Is this something that is deeply politically motivated? Not to say that any of those, again, are mutually exclusive. Something that might be might happen to be beneficial might also be, for one purpose, might be beneficial for the other. The opposite can also be true, that if things were driven by political or business interests, that could be detrimental to the overall goal of what public health is. And as I hope we've discussed today, the role of what the media hopes to achieve in being messengers of truth and information and facts. Which brings me to the last point about how important it is to verify all the information you know, and to seek out those trusted sources in the news, whether that be local, regional, or national. And so that's all we had today, and wanted to thank you all for coming and open it up to the audience who might have any questions. And I'm not sure, Sophia, if
Hi.
there are any questions.
I'm looking at the chat and I don't see any yet. So I just wanted to encourage our attendees, please just, write in anything you might be curious about. In the meantime, I actually had a quick question for you too. I wanted to ask you if you thought there would be any lasting effects on reporting, globally, locally, we can talk about the Marianas or the States, but just as a result of the pandemic, like has the pandemic made a mark, would you say, on how these kinds of things are covered?
I guess I could answer that first. I think definitely, right? This is unprecedented, as we've all learned, and the last year has been really hard. And I think in talking with a lot of reporters, at home and in the US, there's the desire to want to report good news these days. And I think we're finding that in vaccination stories and how people are starting to reunite and get back to, quote unquote, normal. Um, I think I think that we'll continue to see reportage on this in years to come. There's a lot of moving parts. I think, without a doubt, federal funding, local appropriations are something that reporters will be digging into this year and beyond. And so I think um, I have one one mentor who describes it as who COVID winners and COVID losers in terms of reporting. You know, who lost during this time, but and what stories are there that need to be focused on, and who you know, winning is a weird word to use, but who you know survived or who benefited, um, and what stories can that provide? And I think looking at it that way can we'll definitely see stories beyond. And I think Maria would agree that just because the vaccine out doesn't mean that the fight is over, right? We're seeing uh, you know, other nations outside of the U.S. Deal with it even worse than we were earlier on.
All right,
Yeah,
thank you.
on my end, as a public health practitioner and as a scientist, I really struggled between the two lines of being persuasive and being accessible and not defaulting to science alone. Um, we try our best to be clear and open, but there is something about being uncertain all the time because, again, that cliche of rapidly evolving is really true. We are racing against time and we see really fantastic discoveries and leaps and bounds, especially in my field, but it's still a long way to go. And I think the biggest impression and impact is that public health definitely has a long way to go in terms of its public health messaging. I do recognize and know for myself that public health messaging has been all over the place. And as a result, people are confused, and researchers like myself have to know to do better for the future. Um, it's like a moving target. Where do we go from now? How do we keep our eyes on one thing as so many things are shifting and we try to catch up as a profession, as our systems are trying to compensate for really, really big gaps on all ends, not just healthcare. Um, yeah, straddling all of that, people's perceptions of the risk. How do we relay this in something mildly entertaining? We hope to catch people's eyes, to draw them in. We also have to think about the so what's of our messages, because we can say so much and I can hurl all these scientific facts at you and my experiences and my concerns, but what for you as a community member and somebody concerned for their health and for their family? So we can stress so much about the approach for prevention and all these behavioral stuff, mask wearing, hand washing, but what are we doing as a field to move forward? Because we've, in my opinion, we've failed a lot of communities that we've served, and we've seen really big real life consequences because of it.
Yeah, and Maria, I love how you bring up that question. So why I think it for reporters, it's why does this matter? And so I feel like there's a lot of times rush to push the info out, but not contextualize it, right? And discuss the so what. I mean, it's kind of the same question that we're both trying to answer, and can and you know the ways that we respond definitely impacts the community.
Yeah, thank you guys for that. You know, it's a really interesting and relevant subject, and just appreciate you taking the time to put this all together. Um, I want to give attendees one more chance. They've been a little quiet on the chat over here. If you all have any questions, please go ahead and post them up now. In the meantime, where can they find out more about this subject if they're interested in digging deeper?
The CDC remains my favorite. A lot of scientific journal articles from a researcher's perspective are always my favorite.
Yeah, and I guess you know read your local and regional news, and I think every time I have a chance, I always remind people in the community that it's the media's job to hold power to account, and it's the community can hold the media accountable. I think that's one thing a lot of people forget, that you can call your reporters in your community and your editors and ask them about their process and demand better coverage.
Great. And we have a comment here in the chat. It says, greetings from Rhoda. Thank you for an informative and relevant discussion, dispelling misinformation and disinformation. Yeah, thank you both so much. I think maybe we can wrap up now. If there's any last words you'd like to share with our attendees.
Thank you so much for logging on and for this opportunity. Forever honored to be presenting alongside Tomas in this space and with you.
Yeah, same to you, Maria. Thanks so much. And my email is pamanglonia@gmail.com. If you have any story ideas or things you'd like to see in the news, I'm always open to connect and talk to community.
Great. Well, thank you all so much. For the attendees, you will be receiving a survey link in like a follow-up email after this. So please do fill out the survey. And yeah, thanks again to Tomas and Maria. All right. Have a good rest of your day, everybody. Until next time.